the stockout has ended now with 2.3 million doses of the BCG and 7 million doses of the measles and rubella vaccine distributed to regional depots from the Ministry of Health.
And of course, this is quite the encouraging message. I remember in December we were talking about how the shortage of very vital vaccines. And right now we're looking at the Director General of Health, Patrick Amoth, detailing the nationwide distribution plan, with Nairobi receiving the largest allocation of 450,000 doses. We're also looking at the distribution breakdown, shows that Kisumu Depot is going to receive 300,000 doses, Eldoret 290,000, Kakamega 276,000, and of course Nakuru 264,000 doses. Coastal northeastern regions served by Mombasa and Garissa depots each received 120,000 doses, while Meru and Nyeri counties were allocated with 90,000 doses. Quite the reprieve here for anyone who is in need of these vaccines, especially maybe daily or weekly doses that aid in just making sure that we get to fight some of these diseases. And of course, right now we're looking at things like polio. Sijui kama, it was really popular in the 90s, but of course, through vaccination, then we saw it go a little bit down, and most cases are not being reported as we speak.
True. I mean, a lot of diseases that have been more or less extinct for a while do threaten to make a comeback if we're not serious about our vaccination drives. Polio being one of them, of course, that is very, very rarely seen these days. But of course, there's also a buffer stock that is needed by the ministry. And the PS for Health actually talked about maintaining a buffer stock of about 234 doses of critical vaccines. And speaking to local healthcare providers in various areas, they said that one, they had been forced to reschedule and postpone vaccinations, especially of newborns and even small babies, which is very, very dangerous to a country's healthcare. I think we sometimes forget that vaccines work because everyone is immunized. If not, then you start having diseases make comebacks, and then of course your health as a nation is at a risk. Of course, the PS also spoke about more shipments coming. There's about 960,000 doses of oral polio vaccine coming in the next month, and as well as 2.3 million doses of the tetanus and diphtheria vaccine. Hopefully these can be distributed really quickly to counties and of course down to local dispensaries, and enough information is spread out so that anyone who did miss a vaccine, any child who did miss a vaccine, is able to get it.
And in the meantime, I know there's a celebration by government saying that Kenya's new social health authority, that is SHA, has reached a significant milestone with 18 million Kenyans now enrolling in the program that replaced the National Health Insurance Fund. But just 2 days ago, I was seeing, I saw an individual who was admitted in hospital and was not able to access any form of cash, yet their employer has been paying 10,000 shillings per month ever since the enrollment. And of course, it's quite devastating that even for those who are paying for this much needed healthcare service are not getting the care that they deserve.